The way in which you do it, I think, depends a little bit on the patient and on their level of understanding. For some patients, it is enough to point them towards a website like EUFOREA, and they will be able to pick up the information for themselves. Other patients, perhaps who are less versed with the internet, will do better with a booklet, while others need a conversation with somebody. And for that purpose, my nurse becomes involved because she has time to sit with the patients, to explain to them, to talk them through what they're likely to be treated with and what they would like to be treated with. She will find out more about their lives than I will, because they will tell her about the cat that sleeps on the bed, but they probably won't dare tell me. And she can also help them to understand the nature of their disease and the fact that it probably needs long-term treatment, which is hard to come to terms with. I'm hopeful for the future for several reasons. The first is that a lot of research is being done into nasal polyp syndrome, looking at the different kinds, not one disease, looking at the different kinds of patient, looking at the way in which they respond to different treatments, and trying to identify markers which suggest that a patient should be given a particular treatment. And I think that is a good way forward. And we're beginning to get there. We already use things like anti-neutrophil cytoplasmic antibodies to identify those with vasculitis. We use things like IgE and IgG against aspergillus to find out those who have allergic fungal sinusitis, who really do need to have surgery to remove as much of the fungi as possible. But we also need now markers that tell us whether patients will respond to aspirin desensitization, whether they might benefit from anti-leukotrienes, although actually the easiest thing is to use those for a month and see what happens. And possibly in future, we need markers to say this patient should have an anti-IL-5 drug, a biologic, or this patient should have a biologic directed against IgE mechanisms, or a biologic directed against TSLP on the epithelium. So hopefully in the future we'll know what to give to which patient to give them maximal effectiveness.